Another thing you hear a lot about is pneumonia. That a lot of people get pneumonia because of the ventilators in the hospitals. What can one do to prevent pneumonia?
Right. When we talk about pneumonias in with ventilators, they're called ventilator-associated pneumonias, and often patients who get these are in the intensive care unit. So they have a lot of problems to begin with. They're on a respirator, and the things that I'm going to tell you about now, this is when you need to have an advocate. And I stress that that's a very important fact that, when you're well, and no matter what age you are, you have to identify someone that can be your advocate, that can speak for you, can be your eyes, that can be your ears to hear things. That's very important. So when you have on a ventilator, your advocate has to remember to look at one thing in the room, and that's your bed. The bed that you're lying in, they want to make sure that the top of the bed is at a 30-degree angle. And the reason we say that is that when the bed is up a little, you're less likely for the bacteria to get into the lower part of your lung. The second thing, and people don't realize this, they think when a person has a ventilator and a tube in their mouth, they also need oral care. You wouldn't think of going a week or 10 days without brushing your teeth. Well, we need to give patients oral care also, swabbing the area, making sure that we get some of the bacteria out. So your advocate has to be there. Now, in hospitals, usually on the wall, there'll be a checklist, and it will say oral care. And it should be done every 4 hours. So when you go visit your loved one, you want to look for this list and see where it is. If it's not there, you need to ask, why is it not there? And I need to have this done. It's so important because we know the incidence of people dying as a result of this can be as high as 11% or higher. So you want to be proactive in asking, please raise the bed, and also please give my loved one oral care.